Good morning, sir. May I know your name before we start the examination?
I'm Pepa.
Okay, my name is Dr. Christine. So, I see my peers already placed you in lying down position. So, we're gonna do basically varicose vein examination because you've been diagnosed with suspected DVT, and we're just here to confirm that. Can I do the examination if you don't mind?
First,
Okay. So the inspecting procedure gonna be required to obviously inspect your veins, especially the lower extremity. So we're gonna need to touch it. Gonna move your legs around if you don't mind. Okay. So I'm now gonna do 6-step hand washing procedure. Okay. So first I'm gonna check the signs of chronicity. So we're going to see any skin abnormalities of any kind, like dermatitis, edema, swelling, redness, and it seems normal enough to me, like no skin abnormalities. Now we're going to inspect the superficial vein with adequate lighting, so I'm going to light it. So the patient obviously would have their fans off, but I just pretend that he has, so I'm going to inspect it. Okay, so good news, there's no tortuous vein. The veins, at least from inspection, is not too dilated, so that's good news. And then usually the superficial one is more dilated than the deeper ones. Okay, so now I'm gonna obviously I am going to assess the vein. I'm gonna palpate, so I'm gonna touch it if you don't mind. Excuse me. If it hurts, please tell me.
yeah.
Does it hurt?
No.
The veins don't really feel dilated, so that's good news on you as well. And then there doesn't seem to be any obstruction as well, at least from palpation. Okay, next we're gonna do percussion. So what we're gonna do is we're gonna tap the distal veins and then check the proximal veins for wave transitions. Excuse me. So I'm going to tap here and see for the wave transmission. So I can feel the waves, I can feel the blood moving, so that's good. Okay, so next we're going to do the test for DVT. So what we're going to do is we're going to do the turn and lumbar test. So I'm going to need a tourniquet for this. I got the tourniquet ready, I'm going to place it here. So basically what I'm going to do is we're going to test we're going to test the affected leg or the potential suspected leg. So let's say for simplicity's sake, it's the left leg here. So what we're going to do is we're going to want to lift the patient's leg 90 degrees, so excuse me, straight. You're going to lift it straight for 90 degrees or as high as you can, basically. And then just hold it here for around 10 minutes to let the vein go back up. Okay, so let's say 10 minutes has passed. Okay, sir, can you now please wait, can you, oh, sorry. So I have the tourniquet over here, so what we're going to do is want to apply it to the patient's, obviously the patient's upper thigh, so excuse me. So just apply it like that, after lifting the leg obviously. And then what you want to do is, wait, can you please stand, sir, after the words? Okay, so I'm gonna wait 35 seconds. So let's say 35 seconds has passed, so I'm gonna let it go. And we're gonna see the venous filling of the patient. Okay, you may sit down. So the interpretation is, so with venous occlusion, so the test is negative because the venous vein fills itself within 30 to 35 seconds. It's not too quick, so there's no valvular incompetence at all. So that's normal. So that's good for you. Okay, so now can you please lie down again, sir? This is the live examination. I will do human sign. This is another test for DVT. So what I'm going to do is going to take the edge of the foot and I'm going to dorsiflex it. So dorsiflex will be upwards, and I'm going to do it to the patient. If there's any pain in the calf, sir, please tell me. Nothing?
No.
Okay, and then do both legs. Well, you can just do the affected leg, but if you can do both legs as well. And the human sign is normal, 0 is no pain. And that's it, sir. That's all the examination. I'm gonna do this sit class and wash my hands. Okay, thank you, sir. You don't have DVT, so you're good.
Okay, thank you.